My name is Chris Kiefer. I've been on the board of Lifelong Medical Care for 16 years. We have a user majority board. I'm also a client of Lifelong at the Over 60 Health Clinic. My job, I was chairman of the board for a while, and our job as board members is to work to see that the clinic is healthy financially, and that we're doing what our mission says we're here to do, which is to look after low-income and uninsured clients, mostly in the East Bay. And most of our clients are low-income and uninsured. It's wonderful work. I think we do a great job, and I really enjoy the privilege of serving on the board. Lifelong is a full-service primary care clinic. That means that we're the first line of consultation when people get sick. You have a problem, you need help with a chronic illness, or you just need access to the healthcare system, somebody to look you over and either treat you or refer you to a specialist. So we have several primary care sites. We have a dental site, and then we have a couple of adult day healthcare centers which look after very frail, low-income elderly who need someone to look after them in the daytime. The last couple of years have been worse than I've ever seen, with the cuts in the state budget and the economic downturn. We're seeing dramatic increases in the number of uninsured clients who come to our doors. They're not covered by uninsured, I mean they're not covered by anything, not Medi-Cal, not Medicare. They have no private insurance, and many of them cannot afford to pay for basic health care. So for the first time since I've been on the board, we have a growing list, a waiting list of people that we simply can't get into the clinics in a timely way because we can't serve. We would go broke if we tried to serve everybody who's uninsured that comes to our doors. And this is very troubling for those of us on the board, and I'm sure troubling for our clients too. The thing that concerns me most in the short run has been the cuts in so-called optional benefits under Medi-Cal. The cuts in adult dental care. For many people, many of our clients have diabetes or other chronic illnesses, and if they don't get dental care, it's not just a matter of having to live with bad teeth. Their survival, their health, their entire health care depends on having a whole array of services: dental, podiatry, optometry, in some cases in-home care. And the cutting of those services puts them in a terrible situation. If they're not able to pay for them, they're not able to get them, and that's what they need to survive. I don't understand the psychology of a policymaker who would cut services for those people. I mean, what is the function of government if it's not to provide services for citizens who need them and can't get them any other way? So that's my short run problem. ADHC, that's adult day health care, is another service that's been proposed for cutback or elimination, and this would be a disaster, not just for the frail elderly who are served in adult day health care centers in California, but for their families, because their families need those services in order to work and be productive citizens. And if their parents can't go to the services, somebody has to take care of them, and usually it's going to be the family. In a word, I would say it's a really almost laughable, if it wasn't so tragic, false economy to believe that you can save money by cutting services that keep people out of the hospital, out of nursing homes, out of emergency rooms, which are far more expensive ways to treat the problems that they have. In the long run, I would say the healthcare reform bill promises to relieve some of this problem for millions of Californians, low-income Californians who now cannot get insurance. But the state of California has to step up to the plate and assure that healthcare reform is actually implemented as intended in California. That means the state management of the Medi-Cal program has to assure that these changes actually reach people who are entitled to them under the federal. And it's not automatic that this will happen. It means the state has to pay attention to the way it manages the healthcare budget. First of all, that I believe that his priority is to save state taxpayers money by cutting unnecessary programs from the state budget. But I think that if he is advised that cutting these services is in any way a tax saving or a benefit to the state, this is a very sad miscalculation. What we need is new revenue streams, new creative ways of raising state finances so that these things can be paid for, because the alternative is for the state to be A, providing miserable services to its citizens, and B, spending more money doing that than we're spending now.